Yeah, thank you very much for the introduction, and good afternoon to everyone, and thank you to give me the opportunity to present you my work, cigarette smoking and structural brain deficit in patients with atrial fibrillation. So some background information at first. Structural heart disease like atrial fibrillations and cardiovascular risk factor like blood pressure are associated with the presence of brain lesions. And on the other hand, we have smoking, who can affect directly the brain structure, but also indirectly by the elevations of cardiovascular risk factors. And smoking habits are very, very different and variable, and they can have a different effect on the brain. Like smoking duration and the doses of cigarette smoke per day can affect differently the brain. So we wanted to analyze the association between smoking and brain deficits in patients with atrial fibrillations. In order to do so, we performed a cross-section analysis of 7,328 patients from the CCF cohort study, whom my colleague had already spoken about, and we excluded the patients with no MRI or missing smoking informations. Smoking characteristics were self-reported by questionnaires, and we use a standardized MRI to detect the white matter lesions graded by the Fonseca score, the small non-cortical infarcts, and the gray and the wider matter volume. SNCI were defined as hyperintense lesions with a diameter smaller than 20 millimeters, not involving the cortex, and white matter lesions were identified as hyperintense lesions in periventricular or deep white matter regions. We then performed an adjusted multivariable logistic and linear regressions. The predictor was smoking status, defined as never, ex, and current smokers, cigarette smoke per day as collected at baseline visit, and we also asked for the smoking start and smoking cessation. With that, we calculated smoking durations and the time to smoking cessations. The outcome were incidence of small non-cortical infarcts and white matter lesions if the Fonseca score was equal or greater than 2, and the volume of gray and white matter. Here are some baseline characteristics, and the first thing is that the major group was never and ex-smokers, that the never smoker were more female, and that the current smoker were younger and had more history of diabetes. Ex-smokers suffer more of heart failure, coronary heart disease, myocardial infarcts. The alcohol consumption differs substantially, with never smoker having the lowest consumption, ex-smoker drinking significantly more, and the current smokers having the highest consumption. And the current smokers were less likely to be under anticoagulation therapy and suffer more of paroxysmal atrial fibrillations. For the smoking characteristic, the current smokers, they reported to smoke less cigarettes per day, but they smoke also for longer time, like 46 years compared to the 24 years of the ex-smokers. And then we divide intercell for the analysis. And time to smoking cessation was a mean age of 29 years, and we divide it in 4 groups for the analysis. The first result is that about the incidence of white matter lesions if the Fonseca score is equal or greater than 2. And the first thing, there was no significant association in the smoking status, but we find it in the smoking years, in the smoking durations, with patients who smoke between 19 and 30 years and more than 45 years, having more probability to have a white matter lesions compared to patients who smoke less than 18 years. Then there is the incidence of small non-cortical infarcts, and there was again no significant associations in smoking status and this lesion, but there was in time to smoking cessation, with patients who stopped smoking between 11 and 15 years and more than 16 years prior assessment, having less likely to have a small cortical infarct compared to patients who stopped smoking prior 5 years the assessment. Moving on to the brain volume, and here you can see the results of the gray matter, and there was again no significant association in the smoking status, but in the cigarette smoke per day and in smoking durations, we can see that the patients who were in the highest group of cigarette smoke per day and smoking duration had less gray matter compared to the lowest group. And about the volume of the white matter, and we found an association in the patients who stop smoking between 11 and 15 years compared to patients who stopped smoking more recently, they had more white matter compared to these patients. So some of the limitations were that our groups different a lot from each other by the smoking status and the cross-sectional nature of the study. But the strength were that we comprehensively collect the smoking habits and we use an MRI standardized. And to conclude, we found no significant association in structural brain deficits for smoking status, but an association between incidence of brain lesions with smoking durations and time to smoking cessation, and a significant association between the doses and the duration of smoking with gray matter and time to smoking cessation with white matter. So thank you for your attention, and now I'm happy to answer some questions.
Thank you, very nice presentation.
Thank you.
Any question? Here.
You showed that in particular in ex-smoker, there were people that were more prone to substance abuse or use. I mean, they were drinking more and they were less compliant with that treatment. So how can you distinguish the sole effect of smoking, or I mean, formerly smoking, from a more general behavior towards various substances?
The last words?
Substances like alcohol, cigarettes, etc.
Yeah, it's difficult to do so. We adjusted for the alcohol consumption and also for like other factors that can affect the brain structure. Like we collected a depression score, and we adjusted also for that. But the nature of the study, it's difficult to differ from the two things. The better we could do is adjusting, collecting the alcohol consumption and adjusting.
So thank you very much. For the sake of time, we are going on.
Okay.